What is the most appropriate empirical antibiotic therapy for this patient? 60-year-old woman presents to the ED with 3-day history of dyspnea, cough with yellow-green sputum, fever, and chills. She has past medical history of chronic of COPD and is a smoker. Physical exam, her temp is 101.3, pulse 95, respirations are 22, with a blood pressure of 135 over 85. Pulmonary auscultation reveals crackles in the left lower lung field, consolidation of left lower lobe. I think empirically we give a lot of, this sounds like a COPD exacerbation, possibly like pneumonia here with the crackles. I think we've been giving like a lot of ceftriaxone empirically and azithromycin empirically for this kind of stuff. I think Seth is going to cover, it's very broad spectrum. Might be, I don't know if, let's say where is she? She's in the ED. I've just seen a lot of ceftriaxone like thrown at patients.
Okay.
Hmm. Yellow green sputum, COPD. Let's see. Maybe she has a consolidation lower left field. I keep thinking of, is Zosyn azithromycin? Zosyn?
No.
No? They give Zosyn a lot.
Zosyn
I
is
would,
gonna be your Pip-Tazo, right?
yeah, I think so. Yeah, that's right. Yeah, I think I'd go with ceftriaxone. It might be a little too hard hitting, but let's see.
So
Oh,
this is
it's
actually kind of
levo.
interesting. Let's kind
Okay.
of see what they're thinking here. So Levaquin, patient has community-acquired pneumonia instead of
Okay.
COPD. Recommend empiric therapy. So respiratory fluoroquinolones, which is typical and atypical pathogens as are more such as gram-negative bacteria that are more common in COPD. I think the key here is COPD.
Okay.
Anybody else, I think, right, is going to be usually ceftriaxone, right?
Okay.
It's the fact that the patient has comorbidities for drug resistant pathogens
Okay.
seen in
Okay.
COPD. So normal community acquired pneumonia with somebody who doesn't have really much risk factors like smoking, COPD, etc., then ceftriaxone is actually going to be your best answer. Okay,
Okay.
because it's going to cover what strep pneumo, right? That's the most common bug,
Mm-hmm.
right? That gets you lobar pneumonia, right? Azithromycin is going to be in usually healthy patients, right? No comorbidity,
Okay.
but also on top of that, this is walking pneumonia usually, right?
Yeah, like that mycoplasma pneumonia
Yep,
that, yeah.
exactly. So usually not going to be, lobar pneumonia for the most part, right? Augmentin, right? Not really preferred in community acquired pneumonia, and amoxicillin is not usually, right?
Okay.
But it can be in healthy patients, right? But even me, just amoxicillin in my mind, right? If you're sick enough to go to the hospital, amox is usually not going to be on that. All right, let me just
Yeah,
try
that's why I checked.
amoxicillin.
I'm like, how did, in this question, what they said? And they said ED. So I'm like, okay,
Yeah.
it's got to be kind of a little more intense than
Yep. So I guess that
outpatient. Okay.
Levaquin here would be better just because of that
Okay.
COPD history. So